have a case study that I would like to show you for hyperpigmentation treatments with the Pico laser. But first, let me kind of paint the picture of what happened with this patient, and then at the end, I will show you what her before and after looks like. So this is my patient. When she came in, she had hyperpigmentation all over her back. Some of it was due to acne, some of it was due to folliculitis, some of it we're still trying to figure out why, because she gets these dark spots all over her body. So we're going to do some more in-depth testing to figure out what's going on with her inflammatory markers. But she had all of these hyperpigmentation spots, and she wanted me to figure out how to solve this problem. So first, we tested out the Pico treatment on her skin. If you can look in the corner, you might see some little light spots, but the dark spots were persistent. So this was actually my second treatment. I have a video before where I showed you how I did the treatment. Once I was done with the treatment, you can see she has some swelling that occurred in the areas that we treated. And at the top, you see those white spots. That is what we call frosting, and that was a more intense treatment for the more darker hyperpigmentation spots. So not everything is going to be as intense. It just depends on how pigmented the area is and what the laser is able to pick up. And I want to say that the way the laser works is that it's picking up pigment and it's breaking it up into pieces, and then your body's lymphatic system is going to be responsible for draining it. So in some regards, when you do the treatment, right now it doesn't look dark, but afterwards it gets darker and then it goes back to being normal. The spots that you see that are white, they're going to turn black and then it's going to fall off, and she's going to have hypopigmentation temporarily until the melanin around the area is going to be recruited to fill up this spot so that she can get better pigmentation or even skin tone, and I'll show you what that looks like. So this was the second visit that she had, and you can see a lot of the hypopigmentation. It hasn't completely healed yet. This is after 8 weeks, so we're gonna wait much longer, but those areas are gonna go back to being her normal skin tone, and we're just gonna follow up on the stubborn areas where the hyperpigmentation is still persistent. So if you do decide to do this treatment, I would say that expect to have hyperpigmentation, so darkening of the area before it gets better. Also expect to potentially have hypopigmentation, so lightening of the area before it gets better. Typically, I would like to do these treatments in the winter time so that I don't have to worry about sun exposure in the summer. Let me know if you have more questions.